I was attracted to UCL because of its position. It's in the middle of London and I wanted to live in the middle of London. And I came from Cambridge, where it's a multidisciplinary university, and I really was looking for another university that would have the same multidisciplinary approach to teaching and not be a separate medical school. I love the progressive way in which UCL has been over the years, and now very excitingly it's going to be a university where we're putting research right in the heart of our teaching, and I think that's both innovative and very unusual for a university. I'm quite excited to be part of that, and so I've stayed. My role outside of UCL is that I'm a clinician, so I work at the Mortimer Market Centre. That's the largest sexual health centre in Europe, and so we see lots and lots of patients. And I also look after lots of HIV patients in that context. As a clinician, from the day that you start practicing, you are involved in seeing that patients aren't just individuals with illnesses in a vacuum. Basically, they're people who have families, they live in communities, they live in a society, they actually live in a world, and all those things impact on how both they get diseases, but also how they can access services to improve their diseases. And we see many examples of these in practice. The other day I had a patient who has a sort of very long-term chronic condition that needs treatment every day. Unfortunately, he's also had a few skirmishes with the law and is going to be deported from the country. We set up a really strong structure of support, so that he had his family, he had mental health services, social workers, and us looking after him and making sure he took his treatment every day, which keeps him alive. If he goes to a new country, he'll be isolated alone, he will be unfamiliar, he won't navigate the health systems, and he won't be able to take his treatment, and that might lead to his eventual sickness and death. So, as you can see, the structure in which people live, the society in which they live, makes a huge impact on their ability to access services, but also to live happily and healthily, which is what we try to do. My practice is very important for my teaching, and I use it in two very key ways. One is to illustrate examples. So when we're trying to teach a very complicated subject, it's quite useful to have practical illustrations, and health systems and clinics are full of practical illustrations of problems that I can use. But also I think the other side is to really make you realise what the relevance and importance of the subject that we're learning is. It can sometimes become very abstract if you're just looking at numbers and statistics, and I try to bring a human face to that, so you realise why you're doing what you're doing and what the long-term impact of that could potentially be. So I think in those two ways my practice really informs my teaching. As a researcher, I'm really interested in the health and delivery of health to quite disadvantaged people. And these are people who live on the margins of society, either because they're doing illegal things, such as selling sex or injecting drugs, or because they're living in illegal areas like slums. And clearly, to provide health in this setting is a very complex question and very difficult to answer. And I like to bring that complex question to the classroom, so as a group, we can look at innovative ways to deal with those kinds of questions. As researchers, what's really important that we ask the question why and what can we do about it. For example, why do sex workers, women who sell sex in the world, have 10 to 100 times the amount of HIV than people who don't, when we have so many different tools to prevent that and we know what to do. So our role in the classroom is to really tackle these complex questions and ask why and what can we do about it. This BSc would produce graduates that can really help us do several things. One is actually define what we mean by health. What is a healthy person? What it is to have well-being rather than the absence of disease. The other one is how can we best measure this? How can we measure it at a population level? How can we measure it nationally or internationally? But also to help us really develop innovative, equitable and good health systems that we can deliver to our population, so that the patient I see in my clinic daily feels better by the time they leave the room. A BSc Population Health will lead to a huge number of different careers, and the reason is that the area of healthcare is expanding hugely, as we can see in the world right now. There's lots of health problems that need tackling, and there's different parts of it that we can imagine this BSc will lead to. It can lead to people being involved in healthcare provision, either through national health programs or private health programs, of which there are many. It can lead to work around the policy and legal aspects of health. That's an area in which we'll see lots of people will end up in. But actually, even more indirectly, in terms of financial equity markets, many of them are looking at investing in health, and so they will be looking for health literate graduates who will be able to decide where the investment in those equity firms will be. So I think there's a plethora of activities in which you can become engaged with as a graduate of this BSc. The important thing is what we're training is graduates who are able to critically engage with both the statistics, but also have an understanding of the meaning of health and what it means in terms of the population. And this will allow you to also work in areas which are not health related, because of the very strong data analysis and data management skills that people will develop through this course.